I was in the region last week, Friday. The mission was to launch the free primary health care program initiative of this government. And it's being piloted in 150 districts out of the 261. And in the Volta region, I think about 12 districts are benefiting from the initial pilot. The free primary health care is anchored on CHIPS, the CHIPS model system, health centers and polyclinics, maternity homes, private clinics of health center status or maternity health status. And so it is basically for primary health care. What someone would say, OPD cases, you just go, they take care of you and then you go back home. But most importantly, it is for prevention of diseases that can be preventable. So you have people coming to your homes, testing your pulse, and then checking your BMI, body mass index, and also doing some simple tests to see whether your sugar levels are high. Once it triggers that is high, then you are advised to quickly attend hospital. People stay at home, they don't even know what their status is in respect of these NCDs. But we've realized that there's a deficit in infrastructure. There's also a deficit in manpower. If there's deficit in infrastructure, those that are even existing, there's deficit in equipment. And so the minister, in his wisdom, thought that, one, let's fix the equipment situation. So what he has done is to invest close to 1 billion cedis to invest in equipment. And as a member of the health committee, this budget was brought to us for approval, and it's in the formula of both Ghana, the National Health Insurance, and Mahama Cares, that's the Ghana Medical Trust Fund. Then, to fast track building, block mortar, it will delay. So, a new concept of the health kiosk was introduced, and it's a very smart structure. Look, all they need is a platform. Once the platform is done, made of concrete, the fabricated infrastructure is built on it, and within 2 weeks, you have a CHIPS compound in the name of a health kiosk. And it comes with all the necessary equipment that's needed. So you have the office of the in charge, you have a detention room, you have a store, you have an injection room, you have a waiting area, then you have a nurse station where you can take vitals and things. Very smart move. And in fact, because it also takes only 2 weeks in putting up, so far in the Volta region, I understand 5 places are almost up. In Central Town, we start here, where we have one in South Town, we have one in Ketu North, one coming up in Adakru, one in my own place. These are the 5 areas that are up already and constructing. Ketu South, there was a little challenge, but I understand it's been resolved. So I'm sure by now they've also started. That's the 6th one. And I understand the one coming up in catching off. And so the health kiosk is a very smart, quick building experience we are having in the health sector. And there is an upgraded version which has accommodation attached. It also can be built in 2 weeks. And it's 2 bedroom, 2 different rooms, their own toilet and bath, a common hall, and for at least 2 nurses to be resident. And that will afford the nurses to give a 24-hour service to the community or environment they find themselves. And so I'm very glad that this infrastructure is being deployed, and it will go a long way to actually help implement the free primary healthcare.